Hi everyone, it's Dr. Lisa here from Errol Street Chiro. Now, I wonder if any of you out there have been told you've got neck arthritis. And generally I hear people saying, well, it's normal wear and tear, it comes with aging and there's nothing I can do about it. Well, I've got news for you guys. It is not normal wear and tear. It's nothing normal about arthritis. We are talking about osteoarthritis here. And it has nothing to do with you aging. And yes, you can do something about it, not to make this condition progress, because it is a progressive condition if you don't put some stops in place. So hang around, because we're going to have a quick chat about what can cause arthritis and what you can think about in terms of helping to stop and slow down that progression. Okay, so arthritis is wear and tear. It's called spinal decay, it's osteoarthritis, it's degeneration. It is about uneven wear in your body. It's about uneven stresses in your body, and that can come from an old injury like an old whiplash or a fall or a sporting injury. It can come from wrong posture, prolonged abnormal posture, and abnormal curvatures in the spine. So when the spine isn't aligned properly, okay, when the ear's not over the shoulder and that neck isn't straight, over time that can cause some issues, or there's been some old injuries that have not been resolved. So when areas are stuck and they're tight in the spine or they're shifted, we're going to start getting issues with time. Not because you're getting older, just because the problem has been there longer and hasn't been sorted out. So if we start to improve the movement in the joints and start to get your alignment better, that's going to stop the loading. For example, my shoe. Where's my shoe? Okay. Now, sometimes people might see me waving my shoe around. I'll tell you what this is in a tick. Okay, so if you walk around, just to get you to understand why your spine can wear. So if you walk around on your right foot, you've got a problem, say, on the inside of your foot, you're going to walk on the outside of your right foot for an hour or two. Is your shoe going to look any different? No. Okay, now if we continue to walk now on that right side of on the outside of that right foot for a week, a month, a few months, what's going to happen to the right side of that shoe? Yeah, it's going to wear away, of course. So that's exactly what happens in our spine. So if the load is incorrect, if that spine that should be straight has a shift, we're going to start to load one side. If the spine that should be sitting at a 40-degree curve going forward, if we lose that curve or if that posture's forward, we're going to load those joints and those vertebrae differently, and that is what's going to cause problems in those joints and start to aggravate and cause arthritis. That can then eventually cause you pain as well, but there's going to be stiffness. If you've got a lot of stiffness in the neck and some pain, then it is a good idea to get checked and make sure that if we can improve that alignment and the movement in the joints. It is really, really important that your spine is moving well. Okay, guys? Now, what happens over time is that can worsen. That degeneration can start to really get quite nasty because your body is trying to create some stability, and it does that by throwing more bone down. So your body's just responding to the stresses and strains that are being placed on it. Obviously, we can't, get rid of all those spurs and that degeneration, but things can continue to, worsen with time. So again, it is important to understand that you can do something to help to stop and slow down this progression in your body by making some improvements in your posture and in your alignment. So guys, I hope you found this really interesting. Tag someone if you feel that they need to hear this information, and we will see you next time. Bye for now.